So, hello to all my lovely aspiring doctors. I welcome you all to the Medway Online sessions. I am Dr. Shubham Mittal, your ENT faculty at Medway. I am currently a working consultant at Apollo Hospitals, Delhi NCR. We shall be discussing our complete ENT session, and that would be great nurture for you people who are preparing for NEET-PG FMGE and INI-CET examinations. With that beautiful note, let us start. This particular session will be sort of a movie for you all. You'll enjoy this session a lot. It will be approximately 30-35 hours, approximately sort of a movie with a beautiful production house, that is the Medway production house, that is sponsoring all the ENT videos. Anyways, this particular subject discussion has been divided into nose, larynx, ear and miscellaneous topics. First of all, I'll be starting with nose, then I'll be discussing topics associated with larynx, pharynx and some miscellaneous topics of head and neck. And finally, we shall be discussing ear. With that, first of all, let us start with nose. First of all, we'll talk about anatomy of nose. Anatomy is something very important to understand all the basic diseases and the pathologies of nose. So first of all, the topic or the subject that we'll start with is basically anatomy of nose and paranasal sinuses. Talking about anatomy of nose, the thing that you can see in front of your screen is basically a beautiful nose. This beautiful nose that you are seeing from outside, if seen from inside, how it actually looks. See, if I draw a nose from inside, how it actually looks, see, this is a particular nasal cavity, bilateral nasal cavity having a nasal septum in the center. This is the nose, you can see this is the nose. There is a nasal septum in between. This nasal septum, what it does, it basically divides nose into right and left nasal cavities, And now, if I look inside these nasal cavities, there are numerous structures, and these numerous structures will be discussed in this anatomy of nose. Let us go inside. Let us see all these structures and let us discuss all the important points that are important for your NEET-PG, FMGE and INI-CET examinations. Anatomy is always very important. Anatomy is always basics, and these basics are the chunks that basically lead to something called as success. Fine. If I talk about this anatomy of nose, there is a nasal septum in the center. On both the side, we have something called as turbinates. You might be thinking, what is a turbinate? See, what is a turbinate? Turbinate is what? Basic definition of turbinate is a bone covered by mucosa. A bone which is covered by mucosa. A bone simply which is covered by mucosa is a turbinate. On both the sides, right and left nasal cavities, we have turbinates. That means a bone which is covered by mucosa. In general, we have 3 pairs of turbinates. 3 pairs, why I am saying? Because 3 on right side, 3 on left side. In general, rarely there is a 4th one, but in general there are 3 turbinates. What are these? It is the inferior turbinate, the middle turbinate, and lastly the superior turbinate. These are the turbinates: inferior turbinate, middle turbinate and the superior turbinate. Remember that. Rarely there is something called a supreme turbinate, but it is actually rarely. Remember that, rarely. In general, there are 3 turbinates, that are inferior turbinate, middle turbinate and superior turbinate. What is a turbinate? Turbinate is a bone covered by mucosa. Like in this image, you can see this is the inferior turbinate, this is the middle turbinate and this is the superior turbinate. In the image also you can see, and still I want to ask you, which is the largest of all the turbinates? Which is the largest of all the turbinates? Remember, it is inferior turbinate. Very important MCQ. Very important MCQ. Which is the largest turbinate? It is the inferior turbinate. Now let us go inside. Let us look at the facts that are important, that are very important for this anatomy of nose. Going to the next slide. See, I told you, this is the particular diagram that you have to remember with the nasal septum in the center, and on both sides I have something called as turbinate. We have inferior turbinate, middle turbinate and superior turbinate. In the center we have something called as nasal septum. This is the nasal septum that divides nose into right and left nasal cavities. Fine. I told you till now that inferior turbinate is the largest of all the turbinates. Let us look something about septum, nasal septum. Nasal septum, you can palpate it by yourself. If you palpate it above here, you'll feel that it is hard in touch. And as soon as you go down, you'll feel that you can move it on both the sides because it is cartilaginous in the lower part. So remember that the upper one-third part of the nasal septum is basically bony, and the lower two-third part is cartilaginous. If I talk about the septum, nasal septum, upper one-third part is bony and lower two-third part is cartilaginous. Then I told you that inferior turbinate is the largest turbinate. Sir, can you tell me the reason why inferior turbinate is the largest turbinate? See, superior and middle turbinate are a part of ethmoid bone. Remember that. Superior and middle turbinate are a part of ethmoid bone, whereas inferior turbinate is a separate bone. Think about it. Superior and middle turbinate are a part of ethmoid bone. They are a part of something. But inferior turbinate is a separate bone. That is why inferior turbinate is the largest of all the turbinates. It is the largest of all the turbinates. In general, pH of nose is approximately 7. This point you have to remember. Largest of all the turbinates is the inferior turbinate, I told you. What is the anterior-posterior length of the nasal septum? It generally varies, but this is not very important if you are preparing for any of the examinations, because since last 10 years we are not seeing, questions on length of anterior-posterior, length of the nasal septum. This anterior-posterior length of the nasal septum, we are not seeing much of the questions. So not very important to remember. Fine, sir. You told us this is totally fine with us, but okay, the range varies from 7 to 8 centimeters, but fine. I mean, if you are in that particular point, okay sir, can we omit this point? Is it that much necessary? No, it's perfectly fine if you do not know the anterior posterior length of the nasal septum, because it is not commonly asked right now. In fact, not commonly asked. Talking about a very important topic that is called as choana. Sir, what is choana? To make you understand choana, let us assume I have become an ant-man. See, this is me. This is the lateral view of nose that you are seeing in this particular picture. This is me, and I supposedly enter inside someone's nasal cavity. And this is me again, standing very happily inside someone's nasal cavity. I walk along, behind, I walk along like this. There will be a point where nasal cavity will end. See, there will be a junction or a point where nasal cavity will end and nasopharynx will start. This is the nasopharynx that is starting. The junction or the point where nasal cavity ends and nasopharynx starts. Nasal cavity goes like this. We breathe air, it goes like this. A point or a junction where nasal cavity ends and the nasopharynx starts, this junction is basically called as choana. Remember what is choana? Choana is a junction between nasal cavity and the nasopharynx, or it is a point where the nasal cavity ends and the nasopharynx starts. This you have to remember. Going ahead, let us understand a very important topic of olfactory mucosa now. If I talk about olfactory mucosa, where is the exact location of olfactory bulbs or olfactory mucosa? Sir, can you explain? Yes, definitely. A hot bowl of Maggi noodles is in front of me. I want to smell it. If I take a very small breath like this, maybe I won't feel that smell sensation. But to feel any smell sensation, you take a breath like this. And then you say, okay, there is some sort of smell sensation. Why? Whenever you take some sort of a little bit deep breath like this, then you feel that smell sensation, not in a very short breath. You always feel that smell sensation whenever you take a little bit deep breath like this. Why does this happen? This happens because all the olfactory globules have to reach superiorly. Why? Because olfactory mucosa is located superiorly. And the MCQ that has been asked on this particular point is, what is the location of olfactory mucosa? Olfactory bulbs are located superiorly. But where exactly? Close to the cribriform plate. Very, very important point, close to the cribriform plate. Olfactory mucosa, olfactory bulbs are located superiorly close to the cribriform plate. That is very, very important point. Remember this. So we have discussed these particular points. What are the points that we have discussed till now? Sir, we have discussed that there is a nasal septum which is upper 1/3 bony, lower 2/3 part cartilaginous. There are turbinates. What is a turbinate? Turbinate is a bone covered by mucosa. Inferior turbinate, middle turbinate and superior turbinate. Inferior turbinate is the largest of all the turbinates. Why? Because superior and middle turbinate are a part of ethmoid bone, whereas inferior turbinate is a separate bone. Fine. Then I talked about choana. What is choana? Choana is a junction where nasal cavity ends and the nasopharynx starts. And lastly, what is the location of olfactory bulb or olfactory mucosa? It is located superiorly close to the cribriform plate. Fine. I hope these particular points are clear, because it is very necessary that we go ahead. Believe me, students, all the aspiring students, anatomy is always very, very unique, very important and very basic. If anatomy is conquered, believe me, diseases are conquered like anything. This is the reason why the basic subjects, anatomy, physiology and biochemistry, are there in the first year. They are always the base. Then comes your pathology, pharmacology, microbiology. These subjects basically, they are the sort of जिसे हम कहते हैं नींव. These are basically the finding bricks of a huge building. If these are conquered, most of the subjects are conquered very easily. That is very important for you people to remember. Going ahead, let us go ahead. Sir, you told us that upper 1/3 part is bony, lower 2/3 part is cartilaginous for the nasal septum. But can you explain all the parts of the nasal septum? Yes, sir. Let us look completely all the major parts of the nasal septum, all the minor parts of the nasal septum, and what NB is, what NB is in short asking in these recent times. If I talk about the major parts of the nasal septum, they are basically 1, 2, 3 and 4. These 4 you have to remember. First is the septal cartilage. Second is the perpendicular plate of ethmoid. Third is the vomer. And fourth is the crest of maxilla. These 4 are the major parts of the nasal septum. First is the septal cartilage. Second is the perpendicular plate of ethmoid. Third is vomer. And fourth is crest of maxilla. These 4 are the major parts of the nasal septum. But believe me, NB tends to feel that you might not be in that sort of a situation that you are not knowing major parts of the nasal septum. Getting it? NB feels that any aspiring doctor must be knowing major parts of the nasal septum. This is a must know things. That's why they don't ask major parts of the nasal septum very commonly right now. Because what they ask right now is the minor parts of the nasal septum. NB feels that we are knowing major parts of the nasal septum. Actually, NB does not know that we are not even knowing the major parts of the nasal septum. but they feel that we are knowing major parts of the nasal septum, so better let us ask the minor parts of the nasal septum. So they ask minor parts of the nasal septum. These names very important to remember. Minor parts of the nasal septum include spine of frontal bone, spine of maxilla, palatine bone, rostrum of sphenoid, and lastly rostrum of frontal. These names you have to remember. These are the minor parts of the nasal septum, whereas these four that we had discussed earlier, these are the major parts of the nasal septum. Very important for you to remember, very important ahead. I hope this particular point is very much clear. Let us go ahead. Let us talk about something called as paranasal sinus. Let us talk about this very important topic that is basically called as paranasal sinus. That is called as paranasal sinus. That is called as paranasal sinus. Very important topic. If I talk about paranasal sinus, why was this name given paranasal sinus? See, sinus means a air-filled space. Sinus means a air-filled space. Nasal means this nasal part, nasal cavities, and para means little bit away. Air-filled spaces around or little bit away from the nose is basically paranasal sinus. Air-filled spaces around the nose is basically what? Paranasal sinus or paranasal sinuses. I hope this is clear. Sir, can you tell me what are the basic paranasal sinuses that we have to remember? In general, there are 4 paranasal sinuses. Some may say 5. I'll explain why they say 5. 4 and 5 both are fine. These are maxillary sinus, then ethmoid sinus, then frontal sinus, and then sphenoid sinus. What are the sinuses that are present? Are the sinuses that are normally present? Maxillary sinus, ethmoid sinus, frontal sinus, and sphenoid sinus. What happens that ethmoid sinus is basically divided into anterior and posterior. That is the reason why some may say that there are 5 pairs of sinuses. Otherwise, you can say there are 4 pairs of paranasal sinuses. Pairs, why? Because they are present on both the sides. These 4 paranasal sinuses, what is the basic location of these paranasal sinuses? Sir, can you explain? Yes, sir, bachche. Basically, maxillary sinus is present here over the cheeks. Inside, if I go inside these cheeks area, this is the location of maxillary sinus. This is the location of maxillary sinus. What is the location of ethmoid sinus? Sir, ethmoid sinus are present over here. Where? Medial to the medial canthus of eye. This is the location. Medial to the medial canthus of eye. This is the location of ethmoid sinuses. Sir, where is frontal sinus? Sir, frontal sinus is present over here, forehead part. Fine. What is the location of sphenoid sinus? Sir, sphenoid sinus you cannot see from the front because they are located behind. Close to the pituitary region, they are located. They are located behind in the skull base. So, what are the pairs of sinuses? Maxillary sinus that are present over cheeks, basically canine fossa. Ethmoid sinus which is present over here, medial to the medial canthus of eye. This is the location of frontal sinuses. And sphenoid sinuses that are located behind in the skull base. So, if I say you, sir, if I give you a swelling over here and I ask you which sinus or which paranasal sinus is involved, you will say, sir, maxillary sinus is involved. If I give you a swelling over here and I say, which among the following paranasal sinuses is involved, you will say ethmoid sinuses. If I give you a forehead swelling and I ask you which paranasal sinuses is basically involved, you will say frontal sinus. And lastly, sphenoid sinus, I told you, you cannot see it from the front, so it won't come with a swelling. Patient will say, sir, I am having retroorbital pain or I am having deep-seated headache. What is the paranasal sinus involved? It is sphenoid sinus. Fine. Maxillary sinus, ethmoid sinus, frontal sinus, and behind it is sphenoid sinus. Let us go ahead. Let us go ahead and learn the modifications. This is the next topic that we people are discussing right now. What are the modification of ethmoid sinus air cells? What are the modifications of ethmoid sinus air cells? What are the modifications of ethmoid sinus air cells? Sir, if I talk about the modifications of ethmoid sinus air cells, what are these? Can you explain? Yes, sir. There are a number of modifications of ethmoid sinus air cells that you have to remember, bacho. It is very commonly asked. I'll tell you the methodology or mnemonic also, how you can remember it. See, but before discussing the modification of ethmoid sinus air cells, let us study some one-liners associated with, let us study some important, in fact, one-liners associated with paranasal sinus, which is the largest paranasal sinus. Remember, it is maxillary. Which is the largest? See, cheek area is the largest. So, maxillary sinus is the largest of all. Maxillary sinus is the largest paranasal sinus. Sir, which is the most functional paranasal sinus? Bache, most functional paranasal sinus is the one having most number of air cells, and that is ethmoid. Ethmoid sinus is the most functional of all the paranasal sinus. Ethmoid sinus is the most functional of all the paranasal sinus. Remember that. Now, can you explain us the modifications of ethmoid sinus air cells? Yes, sir. There are different names that you have to remember as a modification for ethmoid sinus air cells. What are these 4 modifications, sir, that I have to remember? Let us see. The question that they will ask you, which paranasal sinus air cell is anterior most, or which is the anterior most ethmoid sinus air cell? Which is the most anterior most, or the anterior most ethmoid sinus air cell? The anterior most ethmoid sinus air cell is question mark. The anterior most ethmoid sinus air cell is, the anterior most ethmoid sinus air cell, bache, you have to remember, it is agar nasal. The anterior most ethmoidal air cell is basically agar nasal. And how I remember it? See, can you see this word aage? For the people who understand Hindi, aage. See, aage. Aage means in front, anterior. Anterior. Aage matlab aage. Anterior, in front. How I remember it? I remember it in this way. Fine. Agar nasal cell, aage means in front. It is the anterior most ethmoidal air cell. Talking about the second one, bulla ethmoidalis. How is the question asked? Question asked is, which is the largest ethmoidal air cell? Remember, wherever you will hear this word bulla, see, bulla. Bulla means large. Bulla ethmoidalis. Ethmoidal air cell, which is the largest, is bulla ethmoidalis. The largest, most consistent ethmoidal air cell. Largest, most consistent ethmoidal air cell is none other than your bulla ethmoidalis. The largest, most consistent of all the ethmoidal air cell is bulla ethmoidalis. Next question, if I ask you, which ethmoidal air cell is present in close proximity to the optic nerve? Which ethmoidal air cell is present in close proximity to the optic nerve? Answer is Onodi cell. Onodi cell is basically a ethmoidal air cell that is present in close proximity to the optic nerve. It is located most posteriorly and it is located close to the optic nerve. It is present very close to the optic nerve, and the question that they ask you is which ethmoidal air cell is present in close proximity to the optic nerve, and the answer is onod cell. How you remember it? The first two letters of onod, you can see optic nerve, a fine mnemonic. Optic nerve, onod cell present in close proximity to the optic nerve. And for the last cell, you don't have a mnemonic, you have to remember which cell, which ethmoidal air cell is present close to the orbital floor or is associated with orbital floor, and it is your Haller cell. It is your Haller cell. So these are the four things that you have to remember. Most anterior-most ethmoidal air cell is Agarnesi. Largest of all the ethmoidal air cell is Bulla ethmoidalis. The cell which is present in close proximity to the optic nerve, onod cell, and the cell which is present close proximity to the orbital floor, it is Haller cell. It is Haller cell. I hope these particular points are very much clear. These particular points are very, very, very important for you all to remember. You cannot afford to make a mistake in such particular topics, bachcho. Very, very, very important. These are the points that you have to remember in case you are studying this particular part, anatomy of nose and paranasal sinuses. Fine. Let us talk about the CT findings. How these nose and paranasal sinuses look in CT scan. Bacho, if you read radiology, how I understand radiology, I'll tell you. How I remember radiology, in fact how I remember CT scan particularly in radiology, remember that air is always black in color. If you look a picture of CT scan, wherever you see complete black, that means air is there. Air is always completely black. Bone is always completely white. Air is always black, bone is always white, and rest all soft tissue structures, how I remember it, they are looking like 50 shades of grey. You might be smiling, no need to smile, it is a way to remember. Air is always black in CT scan, bone is always white in CT scan, and rest all the soft tissues are 50 shades of grey. Most of the times, investigation of choice for any haddi problem, for any orthopedic problem, for any bone related problem, it is always CT scan. Investigation of choice for most of the haddi bone related problem is always CT scan. CT is actually, it makes diagnosis for any bone related diseases, CT scan. Sir, can you tell me, maybe it is not a part of your domain, still can you tell me when is MRI done? This is something different. The radiologist should teach this thing, but still I'll tell you, if I talk about MRI, but I'll write it here. MRI is basically done for three things. One, if I want to look at brain or the brain structures are well visualized if I'm, doing MRI. Secondly, if I particularly want to see soft tissues, brain or brain extension by MRI, soft tissues, and lastly, if I want to see any intraorbital thing, intraorbital extension, for these MRI is always better. Fine. I hope this much part is totally clear. You have to remember these particular facts. These particular facts are very, very, very important for you to remember, bachcho. Fine. Let us understand this particular CT scan. I will magnify this particular image, to show you a well-defined CT scan. Now, you have to name these structures along with me. Can you name it? Yes, sir. Can you name this central portion? What is this? Sir, you said that the center part is called as nasal septum. Fantastic if you are answering along with me. Very good. What is the paranasal sinus that is present over cheeks, the largest of all the paranasal sinus? Can you see these? What are these? Sir, it is your maxillary sinus. Fantastic. Air-filled maxillary sinus, air-filled space. Sir, let me erase this for you all. Sir, can you tell me what are these two structures? Sir, it is a bone covered by mucosa. Can you see a whitish bone in between and it is surrounded by mucosa? What is it? A bone covered by mucosa. It is none other than the inferior turbinate. Above the inferior turbinate, which is the turbinate that you can see? Sir, this is middle turbinate. This is middle turbinate. You can also see some of the ethmoidal air cells. I'll mark it with red. Some of the ethmoidal air cells also you can see. I hope you are identifying these CT scan structures. Very important, bacho. You have to understand radiology part also. Very important. Fine. Let us discuss these particular topics in such a way that it helps you not only memorize but understand the core concepts of the subject ENT, ear, nose, throat and head and neck surgery. Fine. If these particular facts of radiology are totally clear with you, let us study a topic concha bullosa. Before studying this particular topic concha bullosa, let us again label these structures. Sir, can you tell me the structure which is present here in the center? Sir, it is nasal septum. Very nice, bacho. Sir, can you tell me these particular air-filled spaces? These are maxillary sinus. Sir, you told us medial to the medial canthus of eye. These particular cells must be ethmoid or air cells. Ethmoid. Sir, what is this inferior structure? Sir, a bone covered by mucosa. This is inferior turbinate. But now, let us look at the middle turbinate. Let us look at the middle turbinate and I will magnify it for you. Sir, you told us what is a turbinate? Turbinate is a bone covered by mucosa. But then, sir, how come, sir? How come inside the middle turbinate there is air? There is air inside the middle turbinate. You told us it is just a bone covered by mucosa. But how come there is air inside a turbinate? Air inside middle turbinate, or we can say it as pneumatization of middle turbinate also. Air inside middle turbinate also called as pneumatization of middle turbinate. This is basically called as concha bullosa. Air or pneumatization of the middle turbinate is called as concha bullosa. Sir, is it normal? No, bache, it is not normal. Whenever concha bullosa is there in any of the case, any of the patient, it is mostly pathological. Patient will have symptoms. When we do a CT scan, okay, sir, you are having concha bullosa. What should we do? We'll do surgery. What surgery? I'll explain you later. That is a FES surgery that we do. But basically, first of all, you have to identify what is concha bullosa. Pneumatization of middle turbinate or air inside middle turbinate is something called as concha bullosa. Remember this particular fact. Concha bullosa is very important for you all. I hope this much part is very much clear with you all. This much part is very much clear with you all. This is very important for you to remember. Very important. You cannot miss these particular topics. You cannot miss these particular topics. You cannot. Basically, understanding anatomy is always very important. Always. You cannot, anytime you cannot miss something called as anatomy. Fine. We'll discuss number of things ahead. We'll discuss.